The normal hearing mechanism sends sound into the eardrum. This sound goes through the 3 bones in the middle ear, and then the stapes bone vibrates it into the inner ear. As you can see on the left-sided panel, this all works very smoothly, and that acts as an amplifying mechanism. However, when there is otosclerosis, as we can see on the right panel, the stapes bone is fixed and does not vibrate, so the sound is blocked from entering the inner ear. Otosclerosis surgery, or stapedectomy, involves removing a portion of that bone and creating a conduit with an artificial prosthesis so that hearing can be restored. To perform a middle ear exploration and stapedectomy, we first raise up the eardrum and then remove the arch of the stapes. We use a laser to make a tiny hole in the footplate of the stapes and then place a prosthesis so that the sound can go directly through the 2 remaining bones and the prosthesis through a newly formed hole in order for you to hear again. Here I am performing a stapedectomy. I have already raised up the eardrum and I am moving the chorda tympani nerve that goes to the anterior 2/3 of the tongue to supply some of the taste fibers. Now you can see the crura of the stapes and the tendon that holds the stapes. I'm using a laser to vaporize the back of the crura of the stapes bone and the tendon. Now I will fracture down the remaining part of the stapes, which is fixed anteriorly. Using the laser again, I will make a very small hole into the footplate so that there is a direct communication to the inner ear for the prosthesis. A few small holes are made, and then a very small microscopic pick is used to open the communication between the little holes made by the laser. You can see a little bit of fluid is coming out of the inner ear. That's called perilymph, and that's completely normal. Now I am grasping the prosthesis. The prosthesis is about 4.5 millimeters. I am placing it first through the hole and then over the incus, which is the middle bone. Now that it's in position, you can see the final position of the prosthesis that is hooked and attached to the middle incus bone and going through the little opening that we made.